Dear friends, I am happy to see you on this Saturday. This is a good day for us because we have finished 1,590 cases of Puberphonia on 28th June 2025. We have completed 1,590. This is a great achievement by us. God had helped us to create an atmosphere for helping Puberphonia boys. So we are happy that we have completed 1,090 cases of Puberphonia. This is the greatest world achievement by us. So we got the recognition from Indian. So this is a health great record and achievement in getting a Puberphonia eradication program. So this is a great achievement by us. And what more we can do with this achievement? That is the big thing we are going in the life. So I am writing the 42nd book on Puberphonia. I have almost completed. Now I am going to edit the book on Puberphonia. The important thing is what is new in Puberphonia. Definitely, there are good treatment for Puberphonia available before Umar therapy. But Umar therapy, what we follow is a new in Puberphonia. So, what is new in Puberphonia? Number one, Puberphonia is not a disease. That itself a great news to the world. Puberphonia is a speech problem which may lead to many socio-economic problems. So, Puberphonia is not a disease, but it is having a speech problem which may cause many socio-economic problems. Try to understand there is no structural problem but only voice problem. Puberphonia revolves around the extent to which it is purely a voice condition versus a psychogenic one. Some individuals experience significant anxiety, low self-esteem, and social isolation, while others may not be bothered about their voice problem despite deviation from the typical adult male pitch. The important you have to remember, we human tend to be most comfortable. We are very comfortable with what we used to it, even if we are not used to its inappropriate or limiting us. What still we have even bullied. That is the main problem. We are ill bullied and made a bad joke of this having such a mismatched adolescent voice. This is the peer influence. The person might be suffering from a more serious medical mental inferiority complex. Do not make it so difficult to a person. So don't increase the agony of the Puberphonia boys. He is already having a hard life with the depression, and there is no married life for him. Do not panic. It can be completely cured. Give your confidence and treat it immediately with an attractive voice which everyone would love to hear. That is the thing we have to understand. No problem in sexual activity or family life, and he can get married, confidently confirm that they will have children. Try to understand. Puberphonia is having normal anatomy. That means it is characterized by persistent high-pitched voice beyond puberty, despite the absence of any organic problem in the larynx or pharynx. There is no structural deformity at all. So that is why it is classified in the functional or psychogenic voice disorder, because the problem lies in the way the voice is produced rather than in a physical abnormality. While the larynx and vocal cord are structurally normal, the individual may exhibit symptoms like high pitch, pitch breaks, hoarseness, breathiness, and difficulty with voice projection. So, what is the voice change? Some cases are linked to improper voice usage. So, it can cause muscle tension in earlier days. Later, it will go for lazy muscles. Some may have deeply rooted psychological factor like anxiety, fear of the low voice, and even sexually identity concern. So that is why greatly linked with the psychogenic and emotional disorder rather than physical one. So these factors can include embracement about the new voice, difficulty in accepting changes of puberty, or social immaturity. So it is not due to the laryngeal or pharyngeal structure problems, but due to the strength at which it acts. So, puberphonia is not caused by any structural abnormality of the larynx, voice box, or pharynx, throat. So, it is why it is considered as a functional disorder. The voice produced through the coordination of the respiratory, resonatory, and articulatory system. In puberphonia, the coordination is disturbed, leading to inappropriate voice quality, but the underlying structure is not the cause. Normal anatomy, but abnormal function. With the larynx and vocal cord appears normal during physical examination, the muscle involved in the voice production may be tense or not working together properly, leading to the high pitched voice. So, this is the basic problem of puberphonia. So, the treatment also, a debate also extend to treatment option, with some advocating the voice therapy as the primary approach, and others explore surgical intervention like injection, laryngoplasty, and thyroplasty. Some even advocate psychological treatment. The debate lies whether the voice therapy alone can involve all cases or if psychological counseling is also necessary. The controversies surrounding its psychological impact, treatment approaches, and the underlying causes highlight the need for a individualist approach and care. It is well accepted throughout the world that treatment option first is voice therapy, which focus on retraining the muscles of the larynx and improve the vocal coordination. But we feel the technique like uvula manipulation involving the uvula, the fleshy hanging at the back of the throat in the soft palate, which manipulation successfully treat puberphonia. The common symptom of puberphonia is breathy voice, which suggests that the air escaping without being properly modulated by the vocal tract. It is more directly related to the specific resonance problem, but rather the way the vocal folds are used and the resulting vocal tract resonance. Essentially, the individual is not effectively utilizing the full potential of their vocal tract resonance, resulting in high pitch, often breathy or strained voice. In puberphonia, what happens? The vocal folds are often held in a position which is favorable for high pitched sound. Even when the individual is physically capable of producing at a lower pitch, but the vocal cords are in favor of a high pitched voice. So, this can be due to the psychological factor, fear of the voice change, or simply habit. Then we have to consider the resonance at the vocal tract. The vocal tract, that is the area above the vocal fold, including the throat, mouth, and nasal passages acts as a resonator. It amplifies or shape the sound produced by the vocal cord. Resonators are R1 and R2, which are specific frequencies at which the vocal tract naturally vibrate, influencing the perceived quality of the voice. While puberphonia is not a direct resonance disorder, it is a high pitched voice which leads to suboptimal resonance. The vocal tract may not be used they, in the way that the fully utilized for the production of the lower frequencies, which is typically associated with a more typical male speaking voice. In all cases of puberphonia, there is a great attempt by speech therapy in which the area is focused on retraining the vocal mechanism to produce lower pitch and utilize the vocal tract more effectively for resonance. So these involves exercise to relax the laryngeal muscle, improve the breath control, and manipulate the vocal tract to achieve a more appropriate resonance. Try to understand, while the vocal cords are typically healthy in puberphonia, the larynx is the target of treatment because it is the mechanism through which the voice is produced and is the area that needs to be retrained to achieve a lower, more appropriate pitch. We have to go on think about the psychological impact. Even though the pitch is only high pitch, but which significantly impact a person's social life and self-esteem. The perceived mismatch between his voice and age and gender can lead to feeling of it leads to a feeling of inadequacy, anxiety, and even depression. So there is a controversy between psychogenic and physical. A key controversy is whether puberphonia is preliminary a physical condition relating to muscle tension or improper vocal cord usage, or a psychogenic, which is a deep rooted in psychological factor. Some argue then comes the great problem of sexual identity. Some researchers suggest a link between puberphonia and concern about sexual identity, particularly in teenage boys. This or they can, or the puberphonia boys might worry about being perceived as homosexual or even question their gender identity, which can exacerbate the psychological impact of the condition. So the treatment approach varies depending upon the perceived cause. Puberphonia treatment is a learned skill. Voice therapy, including exercise to strengthen and coordinate vocal muscle, which is the common treatment. However, some cases require psychological counseling to address the anxiety, fear, and other emotional factors. In cases where voice therapy is ineffective, surgical intervention may be considered, but the success rate varies. So, a comprehensive need for a assessment is there. Potentially, psychological nature assessment is also necessary. Then only we can plan the appropriate treatment. The main focus is on articulation therapy. The focus on improving the physical condition of the sound through exercise, strengthening the soft palate and tongue muscle, and improve coordinatory function of the structure. So, a articulation theory is there, followed by phonological theory, addressing the underlying phonological pattern of the speech, helping the individual to understand, produce the sound correctly within the language system. So there comes the exercise, include uvula positioning exercise, strengthening exercise, repetition, drill, visual and auditory feedback, using mirror, diagram, and listening to the correct sound help individuals correct their voice production. So some cases may need a individualized plans, treatment plans to the specific needs of the individual. Consider factor like severity of the puberphonia or the individual's age and abilities. So we have to think the developmental changes of the speech organ to create legible speech in human being. Human speech involve specific anatomical function deriving from the descent of the tongue to the pharynx. The human tongue shape and position yields one-to-one oral to pharyngeal proposition of the supralaryngeal vocal tract. The new concern in puberphonia treatment focus on the technique like uvula manipulation and voice therapy, aiming to redirect phonation and improve vocal resonance. Puberphonia occurs when the person's voice fails to lower in pitch during puberty. A normal change in usually happens in both males and females. In male, the voice typically drops by one octave, while in female it drops the drop is less pronounced. The human vocal tract consists of a long pharyngeal cavity and short oral cavity compared to the non-human primates. Try to understand. human being is having long pharyngeal cavity and a short oral cavity. But non-human, very big mouth cavity, but the pharyngeal cavity is small. So there is a volumetric shape change of the vocal tract sequentially generate in generation. On the other hand, one simple vocal cord which is has a lot of vocal membrane allows to maintain the vibration stable. Such a vocal source underlay our faculty and correctly convey phonome changes. Here we have to understand about the speech organ. Speech organs in our body involve the production of the sound, speech sounds. It can be three systems: respiratory system, phonatory system, articulatory system. The respiratory system provides air source. Phonatory system produce sound. Articulatory system which shapes the sound into distinct speech sound. So air is required by respiration and voiced sound is because of the vibration of the structures, later articulation. So it is divided into three, namely respiratory system, phonatory system, articulatory system. So where is the problem we have to find? Lungs are there, which is a source for speech, the air, respiratory system. All are having high pitch or low pitch, all are having, even Puberphonia having normal respiratory system. Phonatory system, larynx, vocal cord, which vibrate and produce sound, muscle that vibrate to create the vocal sound. It is there normal. Articulatory system, tongue, a highly mobile organ and shapes sound by touching different parts of the mouth and pharynx. Lips used to create various sound, including the use of rounded and unrounded vowels. Teeth play a role in shaping the sound. Hard palate, the root of the mouth, the roof of the mouth, used to form sound with the tongue. Soft palate, popularly called as velum, separate the oral cavity and nasal cavities, allowing the nasal speech sounds. Uvula, the soft fleshy part of hanging part that is hanging down from the soft palate, used in the production of some sound like the French or nasal cavity used to form nasal sound. Try to understand. Pharynx is a tube connecting the nasal and oral cavities to the esophagus. The organ work together to produce the wide variety of speech sound that human can create. So then next Saturday we'll deal with the difference between the anatomy of male and female speech organ. So today, happily we have completed very, very happily we have completed. So this is a great opportunity for us. We have completed 1,590 cases of Puberphonia on this Saturday, 28th June 2025. So happy. If anybody is having the problem of Puberphonia, call me, Dr.M.Kumaresan, 98410 We are in Chennai at Royapettah, 159 Lloyds Road or CP Raman Road, where we are there from morning 11 to evening 6. We are able to help you, except the Sunday you can consult and have your opinion. We'll give you a good treatment for Puberphonia in 5 days. Today also 3 boys are there. One is there in from Jharkhand. You know that yesterday we have interviewed him. So this is a great opportunity for us, not only helping boy. People, our Puberphonia treatment not only changes the voice, but changes the life of the boy. That is what we are more interested. God had given us a great strength. Thank you. Great, great, great. Next Saturday we'll meet. Happy.